Tuberculosis. It sounds like a disease from old history books, but it still touches millions of lives each year and remains one of the world's leading infectious killers. This calm, clear exploration will explain what TB is, how it spreads, what it does inside the body, how it's treated, and why it persists, while keeping the language simple and the tone compassionate.
Tuberculosis, or TB, is caused by a bacterium called Mycobacterium tuberculosis. This microbe is slow-growing and has a waxy coat that makes it tougher than many other bacteria. That toughness helps it survive inside immune cells, which is a big reason TB can be persistent. TB most often targets the lungs, pulmonary TB, but it can also affect lymph nodes, bones, kidneys, and the brain, which we call extrapulmonary TB. TB spreads through the air, not through food, water, or casual touch. When someone with active lung TB coughs, talks, laughs, or sneezes, tiny droplets carrying the bacteria drift in the air. If another person inhales these droplets, the bacteria can reach the lungs. You don't usually catch TB from a quick handshake or passing someone on the street. The highest risk comes from close, prolonged indoor contact, sharing a home, crowded, poorly ventilated spaces, or certain healthcare settings without proper protection. After inhalation, two very different paths are possible. In many people, the immune system contains the bacteria without fully killing them. The bacteria enter a kind of sleep mode, producing a latent TB infection. In latent TB, the person carries the bacteria, feels well, has no symptoms, and cannot spread TB. Yet latent TB can reactivate months, years, or decades later, especially if the immune system weakens. When that happens, the bacteria multiply and cause active TB disease. Active TB damages tissues, and when it affects the lungs, can make a person contagious. To understand what TB does, picture the lungs' tiny air sacs, the alveoli. Inhaled TB bacteria reach these alveoli and are swallowed by alveolar macrophages, the immune cells designed to eat and destroy invaders. TB bacteria are clever and can survive inside these macrophages. Over time, the immune system walls off the bacteria by forming tight clusters of immune cells called granulomas. Think of a granuloma as a cage. Bacteria sit at the center while layers of immune cells form the walls. Inside, tissue can die and become soft and cheese-like, a change called caseous necrosis. If the immune system stays strong, granulomas remain stable and infection stays latent. But if the immune system weakens or the bacterial load becomes high, granulomas can break down. The caseous material may liquefy, empty into an airway, and form a cavity. Cavitary lung TB is highly infectious because each cough can release many bacteria. Not everyone exposed to TB becomes sick. Certain conditions increase the risk that latent TB will progress to active disease, HIV or other immune suppression, poor nutrition and low body weight, diabetes, smoking, heavy alcohol use, or certain drugs, long-term steroids or chemotherapy, and living or working in crowded environments such as shelters, prisons, and some healthcare settings. TB disproportionately affects areas with poverty, overcrowding, and limited access to healthcare. Symptoms of active TB depend on the organs involved. For lung TB, common signs include a cough lasting 3 weeks or more, chest pain, coughing up blood or sputum, fever and chills, night sweats, unexplained weight loss, loss of appetite, and chronic fatigue or weakness. Extrapulmonary TB may cause swollen lymph nodes, back pain from spinal TB, urinary symptoms, or neurological problems in TB meningitis. These symptoms are not specific to TB, which is why medical evaluation and testing are essential. Diagnosing TB is a stepwise process. A healthcare provider gathers the story, symptoms, duration, exposure, travel, and risks, then orders tests. A chest X-ray looks for lung changes suggestive of TB. Sputum tests examine mucus from deep in the lungs under a microscope for acid-fast bacilli and may be cultured to grow and confirm the bacteria. Molecular tests, nucleic acid amplification tests, can rapidly detect TB DNA and identify drug resistance. For latent TB, the tuberculin skin test or interferon gamma release assays detect immune responses to TB without symptoms. The good news, most TB can be cured with the right medicines taken long enough. Because TB bacteria are slow-growing and hide inside cells, treatment uses multiple drugs at the same time and continues for several months. A typical regimen for drug-susceptible TB starts with 4 medicines, often isoniazid, rifampicin, pyrazinamide, and ethambutol, then shifts to fewer drugs in a continuation phase. Exact regimens vary by guideline and resistance testing. It is crucial to take medicines exactly as prescribed and to complete the full course. Stopping early or inconsistent use fuels drug-resistant TB. Drug-resistant TB is a serious challenge. When bacteria resist key first-line drugs, especially isoniazid and rifampicin, we call it multi-drug-resistant TB, or MDR TB. More severe forms resist more drugs and may be labeled pre-XDR or XDR TB. These require longer, more complex, and often more toxic treatments with close monitoring and specialized care. Preventing resistance depends on correct regimens, steady drug supply, and strong support for patients to finish therapy. Prevention rests on prompt diagnosis and complete treatment of active cases to stop transmission, infection control like good ventilation and masks in high-risk settings, vaccination with BCG in many high-burden countries to protect children from severe TB, and preventive therapy for high-risk people with latent infection. TB is also a social and psychological issue. Stigma, job loss, financial stress, and the emotional burden of months of treatment matter. Counseling, social support, and clear education boost mental health and treatment success. TB is old but not gone. It spreads through the air, often attacks the lungs, and can be latent or active. Most TB is treatable and curable when diagnosed early and treated completely. Preventing TB and drug-resistant TB needs strong public health systems, reliable medicines, and compassionate patient support. This video is for general education and not medical advice. If you have a persistent cough, fever, weight loss, or night sweats, especially with exposure or risk factors, see a healthcare professional. Understanding TB is the first step toward defeating it.